Hi guys, I'm Dr. Greer if you don't know me, and if you do, video. I thought you guys might be getting sick of seeing just the plain blue wall behind me, so I switched it up a little bit. I'm in front of the window, so I've got some good lighting, and you can see the chair I normally sit in is behind me, so you can see all my messy desk stuff. I hope that's exciting. Anyway, just changing it up a little bit. So today I'm going to talk a little bit about liposuction. Liposuction is seriously one of my favorite procedures. If you've heard me talk about it in the past, you know that I had it myself last July and I love it. My stomach is so flat and it was seriously not a bad recovery. Just checking my mic. You know, I hadn't had surgery before, so I wasn't really sure what to expect, and it seriously wasn't bad. So I'm going to describe a little bit about what the recovery is like after liposuction today and hopefully answer some questions for y'all. Now, I can only speak for myself and my patients, but I've done, I think, 600 or 700 liposuction cases in the last several years. So I do have a lot of experience in this area. If you see another surgeon, though, they may have different recommendations or different post-op instructions. Surgery is more of an art form than a science in a lot of ways, and we all kind of tweak what we do with our patients post-operatively. So what I'm telling you today only applies generally to my patients. If you have liposuction with somebody else, make sure to ask them specific questions, just so you get the best answer for you. So when I do liposuction, I do it as an outpatient, which means my patients go home the same day. And honestly, that's true for most of my operations. Even tummy tucks lately, you know, my patients are healthy, they're reasonable people, they'll call me with questions, and they're so much more comfortable at home in their own beds. So there's only a couple of cases where I will keep people after surgery. So liposuction patients go home the same day. Now you are under anesthesia, you are medicated, so you need somebody to drive you to the hospital and drive you home. That is very important. You also need to have a responsible adult with you for that first 24 hours. You've been medicated, you've had surgery, you're not necessarily thinking with great clarity, so it's important that you have somebody with you. Please don't think you can drive yourself home after surgery. It's still real surgery, even if it's minimally invasive. One other thing to be aware of with liposuction, you're going to have a lot of drainage the first 24 hours. Now the incisions are really small. They're the size of a staple, 4 millimeters, which is the size of the cannula, the tube that I use to suction out the fat. So small incisions, but they will drain copiously. Copious is a good word here. What's coming out is actually the numbing fluid that I put in. It's called tumescent, and it's a mixture of basically IV fluid, lactated ringers. It's got some epinephrine, which helps prevent bleeding and bruising, and then it's got lidocaine, which numbs up the fat and makes it more comfortable. So we put a lot of that fluid in, like seriously, leave much surface area we're lipoing. And a lot of it comes out with the fat, but not all of it. So that's all what's draining out that first 24 to 48 hours. Most of it's the first 24 hours, and you may feel like an uncomfortable gush if you move or shift around, and that's totally normal. It's just a nuisance. After the 24-hour mark, if you do have drainage, it's like you may notice a little damp spot on your shirt or something. So for that first 24 hours, we put some absorbent pads over the incisions, and then I do recommend put an old towel or a blanket in the seat of your car before surgery, and then set up wherever you're going to hang out at home. So if you're going to go right to bed, or if you have a lazy boy that's really comfy, put an old towel or some blankets down that you don't mind getting tinged with a little bit of blood. So if you have darker clothing or older towels, stuff that you don't mind necessarily getting stained, you can be sneaky like me. I went to my mother-in-law's house after surgery and laid on her couch and got her towels wet. Thank you, Sherry, for that. But just make sure you're prepared, because that first night's a little messy. Now, I don't leave drains after liposuction. I think that's pretty much the norm, but in occasional cases you might have a drain. So we're not talking about drains at all today, because that doesn't apply to my standard cases where I'm just doing liposuction and not adding in a tummy tuck or something. I do let you shower the next day. It's okay to get your incisions wet that quick. I think people feel a lot better when they're clean, and honestly, showering regularly means less bacteria on your skin, which means you have a lower risk of infection. So that next you go home with a compression garment on. It's kind of like a heavy duty Spanx. And when you first take that off, you'll have some volume shifts, like your blood may rush to your legs, and it's normal to get a little dizzy and lightheaded. So take it really slow when you take your garment off for the first time and have somebody there with you. Your skin is going to feel super weird. Just word of warning, it feels numb. Sometimes it feels like it's itching inside. It may feel tingly. Those are all normal, but the first shower is going to feel a little weird, and that's okay. So just mild soap and water, let it run over the incisions, pat dry gently with a towel. In terms of incision care, I don't always suture these incisions shut because they're so small. The scar heals really well without a stitch, and I want that fluid to drain out. So you're not going to have any stitches to take care of. Incisions do heal more quickly though if they're kept moist. There have been studies on this. Sorry to use the word moist. There's not another scientifically applicable word here. So I like Aquaphor or Vaseline. Aquaphor is basically Vaseline with some lanolin in it, so it works fine. Straight old Vaseline out of the tub works fine too. Just put a little dab on your incisions twice a day until the scab falls off, and that'll help them heal more quickly. The more quickly they heal, the less of a scar you will have. So that's all you have to do to take care of them. Once they're totally healed, I recommend scar cream. The one we carry now is called Silogen. Before that, I think we carried Kelacote. They're all medical grade scar creams, and the main ingredient in those is silicone. That's different from a Derma that you'll buy over the counter. That is not a silicone-based cream. So they're very effective at helping scars stay flat and lighten up because they're initially kind of pink. The Silogen we carry also has sunscreen in it. Sunscreen's really important that first year because scars can get darker in the sun. It's called hyperpigmentation. So if you put the Silogen on twice a day, you're good to go. But you don't do that until the scabs have fallen off. It's also important that you don't bathe in a bathtub or go swimming or go in a hot tub until those incisions are totally healed and the scab has fallen off. So that's usually about 3 weeks. I see you 1 week after surgery, and for my patients, I also give them a phone call that first night. I find when you get home, you may have a lot of questions, so I like to check in by phone. In terms of pain after liposuction, here I can speak from personal experience. It's not really a surgical pain like if you had a C-section or an appendectomy. With those, the actual muscles in the abdominal wall are getting cut, so every time you move, it's pulling that muscle, which hurts. With liposuction, it's just fat. There's not a ton of sensory nerves there. And it's really more like a deep, deep muscle soreness. So say you're new to CrossFit and you do a full workout, you know that feeling 2 days later when it's kind of hard to get up and then you get moving and you're okay? That's what it feels like. You know, I had it on my stomach, so it was like I did a whole lot of crunches. It's really doable. Honestly, I do give my patients narcotic pain medication. It's Norco, which is similar to Vicodin. I think I took one of those after surgery, and some people need more. Everybody's a little bit different. Everybody feels pain differently, and if I take more fat out, you may have more pain, but honestly, I think ibuprofen, Motrin, or Advil, those are all the same thing, by the way, those are going to be the biggest help for pain after surgery. The Norco is really just for that first day or two, and maybe to help you sleep that first night. Now, cool compresses can help as well. The big caveat here is your skin's numb, so if that cold pack's on too long or it's too cold, you're not going to feel it, and you literally could get frostbite. So I give out gel packs in my pre-op goodie bag. I recommend just put them in the fridge, and if you have a spot that's really sore, you can put that on. The other thing that can help if you have those weird itching or burning sensations is if you lightly rub on the area or tap it. That's going to do what's called nerve confusion, and basically it's giving your nerves a different signal to carry so that basically the bandwidth to carry that weird sensation of itching. So that helps tremendously. Thank you to Alana Beckett for that recommendation, one of my friends. So skin will be numb over the area that's treated, and that lasts for up to 3 months. It basically gradually gets better. The nerves have been cut, so they need to recover, and nerves need to regrow. And they grow at about 1 millimeter a day, so maybe 1 inch a month. So it takes a while. But what happens is the numbness gets less and less and less, and then one day you realize it's totally gone. It does take about a month before you feel totally back to normal. I didn't certainly want to really work out for that first month, and having my kids jump on my lap was not awesome, but it was doable. And after that first month, not so bad. So let's talk about activity restrictions, because that's always a big question. When can you get back to working out? When can you get back to work? In general, for liposuction, I recommend no lifting more than 15 pounds for the first month after surgery. Now, this is it's a recommendation, it's not an absolute requirement. And difference with some operations, like if you have a hernia repair or if you have a tummy tuck and those stretched muscles are repaired in the middle, if you lift something heavy, you tighten your muscles up and you can literally pop the repair and undo all the work. With liposuction, the big risk is you're just going to increase swelling, and if you're moving around a lot, so the skin gets kind of lifted up off of the area the fat's removed, and it needs to heal back down. So if you're bending and twisting and turning a lot, that skin may be shifting around too much, and then you can get a fluid collection under the skin. It's called a seroma, and it's kind of like an internal blister. So that's the biggest reason you need to take it easy. Your swelling's going to get worse, which is going to make your pain worse, and you could get a seroma. So let's say you have to pick your 2-year-old up once and put him in a crib. That's going to be fine, but I don't want you carrying heavy boxes or mowing the lawn or washing windows or things like that. So I mentioned no repetitive bending or twisting. It is okay to get back to light exercise after about a week. You really need to take it easy that first week, even if you feel okay. And then after that, if you're really an exercise junkie, it's fine to get back to walking, but you need to take it easy. So my personal definition of that is don't get your heart rate over 100, because that's really where you're doing heavier cardio work, and that's going to increase your swelling. So light walks, no speed walking. Now, that's a 4-week restriction. So light walking is okay for 4 weeks, but I don't want you to get back to weightlifting, sports, running, elliptical, bikes, things like that for a full month. And after that, ease back into it. Your body has healed. It's actually taken a hit. You'll probably be a little more tired in those first weeks after surgery. So ease back into things. Don't just throw on your running shoes and go for a 5-mile run. I mean, assuming you can run 5 miles. I personally couldn't do that anyway, so I'm not too worried about it. But don't just jump back into your regular CrossFit routine. Start off easy and see how you feel, because it takes a little while. Now, when can you return to work? Also a very important question, and that largely depends on your job. Obviously, you want to wait till all the drainage is done, so at least a day. You need to be off the narcotic pain medication too, which again, a couple days at most for most people. The other big thing is what kind of activity you have. So if you are doing a lot of bending and twisting, say you're cleaning houses or painting, you're going to need to be off for a couple of weeks to let things heal. On average, most people are back a few days to a week. I think I had surgery on a Monday. I went back to work on Thursday. And that was okay. My job, I was actually doing liposuction that day, so it's a little more physical, but nothing crazy. And that was no problem. I was tired at the end of the day, but it was very doable. So when you're at your consultation with your surgeon, tell them what kind of work you do. Ask about how long you'll need to be off work. It's going to vary depending on your job. For liposuction, though, it's usually not too bad. Sorry, just checking my mic. I felt it slip. So hopefully you can hear me. Now, driving is also an important question, and again, the big thing is you should be off your narcotic pain medication. So don't drive medicated, please. But in general, if you're taking Tylenol the next day or Motrin, you're fine to drive. Just make sure you can check your blind spot and make sure you feel like you can react quickly, and if you slam on the brakes, it's not going to really, really hurt. Okay, so now we're going to talk about compression garments. With liposuction, there's a lot of swelling, and your compression garment, that heavy-duty Spanx, basically is there to help keep that swelling to a minimum. The less swelling you have, the faster you will heal, and the less pain you will have. So these are measured for at your pre-op visit. I do the measuring actually at your consultation. And in my office, at least, we order the garment and I bring it to the operating room with me, so it's nothing you ever have to worry about. I do recommend get 2. It is nice to have 1 spare so you can wash it, and they do stretch out a little over time. They come in nude color and black. I recommend the black, at least for drainage, but you can get a nude one later if you want. They're actually pretty comfy. They slide on, and then they've got like hook and loops up the side and a zipper. So they're a little tricky to get off and on at first, and then you get used to it, and it's not so bad. Now, you are going to wear that 24/7 for the first month. And that first week, if you have your abs or your waist done, there's actually a white abdominal binder that goes over it just for some extra compression. It's really important that you keep that garment on. Unless you are showering or you're throwing the garment in the laundry, keep it on. Because if you take it off for more than about half an hour or an hour, your swelling's going to increase and then your pain's going to increase. So seriously, keep it on. It's also kind of holding your skin in place so it can heal back. and not slide around and form those fluid collections. I see people get into trouble when they don't listen and they take their garment off, and then they come in and they're really swollen, and then it's very hard to get the garment back on. So wear your garment, people. Honestly, most of my patients follow directions really well, but it is very important. How long you wear the garment after that first month really depends on your swelling. People with more extra skin or who had a whole lot of fat removed generally have more swelling, so they're going to wear that garment longer. If you're thinner, you have less fat removed, you don't have a lot of loose skin, then the garment is going to be able to come off sooner. So expect to wear it 24/7 for a month. At the very longest, you'll wear it for 3 months, but that second and third month, you're just wearing it at night, or you're just wearing it at work, whatever's most comfortable for you. So only half the day. You will have some bruising too. Be aware of that. Everybody bruises differently too. I can't really predict who's going to bruise badly. If you have surgery on your legs, you will, I guarantee, on the abs, maybe not so much. So here's a little tidbit of knowledge for you, should you have lipo. Swelling and bruising drift down with gravity. So if you have your stomach done, the pubic area is going to get very swollen and very bruised, usually about 2 days afterward. This is totally normal, but it's a little scary for some people because they're thinking, hey, I didn't have surgery there. Why does that look like that? It's normal, it's okay. But it does take a couple weeks for the bruising to fade completely. The swelling can last a good 3 to 4 months, and what you'll feel, like initially it'll be really hard and almost woody is what we call it, and then it'll kind of soften, but you'll still feel little lumps and bumps, and those are totally normal. That's just areas of swelling. You'll definitely know it's swelling if a lump that feels like a golf ball in the morning and a pea at night. That's swelling, and it's totally normal. So be reassured that will ultimately go away completely. It can take a few months though. The other times you may notice more swelling is if there's a lot of activity, like the first couple of times you exercise or when you go back to work, just because your body's getting used to that, you'll have some more swelling initially. And that's the other reason I recommend taking it easy initially. So after 3 to 4 months, most of the swelling will be gone. The bruising will definitely be gone, but I do recommend don't judge your results, your final results, until 6 months. And the reason for that is your skin will shrink up a bit, and it takes time for that. If you've ever had a baby, you know that the stomach does get better, that skin does shrink, but it takes some time. So I always urge my patients, don't judge the results until 6 months after. I have them come back for photos at 3 months and 6 months. And then by that point, that's pretty much what you're gonna look like. Now, again, if you have specific questions about recovery and you're not my patient, you need to ask your surgeon because we're all a little different and we're all a little picky. If you're one of my patients or you're thinking about seeing me, I'd love to have any questions in the comments. And I seriously hope you found this video helpful. You guys have a great weekend, and I'll see you next week.